Hello all. This video is about full mouth guided implant surgery using the Blue Sky Bioplan by Dr. Sheetal Saklecha. Dr. Sheetal Saklecha is a leading prosthodontist and implantologist and the owner of Suntosh Dental Care. Let us have a brief description of what an intraoral scan is. An intraoral scanner is a handheld device used to directly create a digital impression of the oral cavity. Light source from the scanner is projected onto the scan objects, such as full dental arches, and then a 3D model processed by the scanning software will be displayed in real time on a touchscreen. It is helpful in enhancing patient scanning experience, give fast results, increase accuracy and educate patient in a better way. At first, the CBCT scan of the patient is taken. Then we go ahead with the process of synchronizing the CBCT scan with the intraoral scan or CAS scan. Following the synchronization process, the treatment planning is carried out and sent for approval to the doctor. This is a critical step where the position, angulation and depth of the implants are finalized. Post-approval of the treatment plan, the final surgery guide is designed. Then the surgical guide is shipped to the doctor's end. Next up we proceed with the surgery of the patient. The initial sitting is done on the patient. Drilling is done for insertion of fixation pins. This step ensures stability of the surgical guide during surgery. Then the doctor goes ahead with the pilot drilling followed by subsequent drillings as per the drill sequence reports included along with the surgical guide. Post-drilling, the surgical guide is removed and implant is placed. After ensuring successful implant placement, the temporary prosthesis is placed over the implants with the help of healing abutments. Hope you had a great surgery experience. Pioneering digital dentistry with renowned dentists for decades.